أو إصابتها بالفيروس. طبعا كان في هناك مخالطة ل سواء كان يعني ناس أفراد من العائلة أو أماكن عمل أو حتى أماكن أخرى. فمن الضروري أن احنا نتبع هذه المخالطات ونتعامل معها بأسرع وقت حفاظا على سلامتهم وهم، سلامة أسرهم، وسلامة المجتمع بشكل عام. وقامت وزارة الصحة مشكورة الآن بوضع التفاصيل هذه على الموقع. فالمطلوب أن أي شخص يجد في الموقع فيما يخص تتبع هذه الحالات أي يعني علاقة له في موقع أو شخص معين أو وقت معين، أنه يبادر بالاتصال على 44 على أساس أنه 444 على أساس أنه يضمن أن يتم يعني حمايته وحماية أسرته ويتأكد من سلامته. طبعا بالرغم من تقليص عدد الرحلات القادمة.
Though we have reduced the number of the incoming planes, but we cannot really close all the entry points. So the entry points will be open. We cannot isolate ourselves economically and socially. But at the same time, we are taking procedures to protect our society. And I would always repeat that we are in a good situation in dealing with this virus much better than other countries, but we have to remind ourselves that there are updates and we need always to be ready. As long as we are ready, we're not going to be surprised and not going to be in a bad situation, and that's what we are working on, and the other entities as well. So it is very important that each one of us would take the responsibility at the family level and the society level to take the right steps, not to mingle with people, and if there is no necessity, and to avoid the gatherings. As you know, there was as a precautionary measure an issuance by the Council of Ministers to stop the gatherings of around 150, just in order to protect people from this infection. And before I conclude, I just would like to truly express my words to the national cadres and staff from all different entities, whether health, security, PDF, media. All of them are working hard, and I've seen myself, they are continuously working, and their objective is to provide safety and serve Bahrain and the people of Bahrain. Even those who were recovered, they took the initiative to be volunteers in helping the infected people, and this is the national spirit that we are proud of. So I express my sincere thanks to them, and hopefully God will protect Bahrain and everyone. Thank you very much. Thank you very much, Lieutenant General Tariq Al-Hassan, for this briefing. Maybe today everyone has heard the news of the first death case for a female Bahraini national. The case was in isolation in hospital. She's 65 years old. So the citizen had chronic health problems. So while having this infection has increased her problems, so we express our deepest condolences to her family and we express our sincere condolences, and hopefully we're not going to have any other cases in the Kingdom of Bahrain, and that's what we're working on. As you know, the World Health Organization has explained that most people who would have the risk are the elderly people and with chronic diseases. That's why those people should avoid any places that would increase that risk and take this into consideration. But the numbers we have that are updated on a daily basis, whether on the media and the website, show us that we are assured. But from the medical side, we need to be ready just in case any increase in the current number. So we need to just keep this in mind, that the current number would be stable. We might have, by any chance, any increase. God forbid. I don't think we cannot provide the isolation for each case. So as is happening, the containment is there. So just hypothetically, if there is an increase in the number of the existing numbers locally, that would give us a priority to provide the treatment and all the equipment necessary in hospitals for the critical cases. So the priority would go to the critical cases, and the treatment would be available for the other cases that are not critical. And it is important that those non-critical should be isolate themselves at home or in different in separate rooms. So this would be the hypothesis, just in case we had the increase in the number. And through this, we would put more focus on the critical conditions, and we would be able to reduce the number of deaths, God forbid, and we're trying our best to decrease the number of those cases. Also, there are some measures that can be taken if there, by any chance, any increase in the existing numbers. We would provide the intensive care departments to provide the necessary treatment for the critical cases of this infection. And even that, we would like to assure all citizens that they would be provided with all the health and necessary equipment, and that would not affect their daily life. And also we have medical plans in case there is any increase in the number. We would provide additional measures that would be announced in the right time, and they would be in a variety. For example, maybe to suspend the study in schools, maybe to stop the gatherings in the public gatherings. Each plan would be declared and then announced at the right time. And these measures would be temporarily, but of course would have great impact on the reduction of this virus. Thank God, the virus is not spread, but we're taking all the important and necessary measures, and we need always to think about what would happen and how we would deal with it. So, as part of our efforts, our national responsibility is continuous, and we would continuously explain all the updates, and as mentioned by Lieutenant General Tariq Al-Hassan, in all transparent manners, and we shall all avoid rumors and So we have plans for any cases, and we affirm that to maybe more and repeatedly, even like in newspapers, and sometimes to avoid rumors, we always focus on not believing rumors. In all the ministries, in all the entities, all information would be available to everyone step by step, and so we ask everyone to follow up and read all this information. We have the website of our ministry, Ministry of Health, and so these are the official channels that we hope people, everyone, would read and take this information from these channels. And we have many guidelines that are available on the our website in terms of the personal hygiene, and even like on the roads. So we always emphasize that we try as much as possible to avoid the public gatherings in order to contain this virus. And the people of Bahrain, thank God, are understanding. They are cooperative, so we would always ask them to look after themselves and after their families, because this is the time where we need everyone to listen to the guidelines and instructions on all the official channels. That's what I wanted to explain, and I'll leave now some of the details in terms of food and items in the markets. It is very important, and the economic situation. So I'll leave that to my colleague, His Excellency Mr. Zayed bin Rashid Al Zayani, Minister of Industry, Commerce and Tourism, to give us an update as part of their ministry. Thank you very much, Your Excellency Dr. Faiqa Saeed Al Saleh. Peace be upon you. First, I'd like to express my sincere thanks to the wise leadership in dealing with this coronavirus situation, and thank my sincere thanks to His Majesty King Hamad bin Isa Al Khalifa, King of the Kingdom of Bahrain, and also my thanks to His Royal Highness the Crown Prince. And also would like to express my appreciation for the national efforts, all those who are working at the front line of the medical staff, of the volunteers. We've seen so many volunteers in a very short period of time who have been working at the national Bahrain International Airport. All of them are working at the front line. And also we shall not forget the supporting team at the background, because without those, we won't have the services at the high efficient levels. So we thank you, and God protect you, and we would be helping you in all the times. Also, I would like to express my deepest condolences to the Bahraini national who passed away, and hopefully we would have more good news in the future and more recoveries in the future. Also, I would like to thank the press and media for spreading accurate information and news, and for giving the right picture. And it is one of the challenges that we need to pay attention to, as mentioned by the Lieutenant General Tariq Al Hassan and Her Excellency the Minister of Health, to avoid the rumors and track information from the official channels, because the most risky thing is to create panic and follow the lies. So we need to work in a very calm and wise manners. We are working hard to track time and keep informed of the updates in this virus and to deal with it and change our plans accordingly. And we need to be really cooperative and be one line in confronting this virus and not to create panic or any rumors. Out of this, I'd like to assure everyone of the role taken by the Ministry of Industry, Commerce and Tourism as part of the personal efforts and directives of His Royal Highness the Crown Prince in dealing with the Chamber of Commerce and Industry is to track the economy, the economic situation. We are going into a situation that requires our economic situation. And it is a very difficult situation, but everything is going to be on. So in a situation that we need to go through these difficult times into going into the normal times. So as mentioned by Lieutenant General, to focus more on providing the good stuff and items. So we're working hard in our ministry and working with the traders, the main traders of the food items, to ensure that the main items of food of a minimum of 6 months in the Kingdom of Bahrain. And thank God we are working within this level and we are doing that in a timely manner and as within the plan of the adopted plan by the government. So we really don't need to get panic and we are really working in the right track in this regard. Also, we are working and conducting meetings with the Chamber of Commerce and Industry as the representative of the of this field in Bahrain, and by activating the 10 committees in all the fields of the economy. So we look into each field in the economy, we look into the challenges in this time and ensure that all their work is going on. And we've conducted 2 meetings with the Chamber of Commerce on Thursday and yesterday. And also we have another meeting by the end of this week. I think I don't want to go long, but my message here is has been repeatedly said and stated. As for the items and food items, we assure you there is no shortage, and we are in fact going to see that in reality. Thank you very much. Thank you very much. I think Lieutenant Colonel Dr. Manaf would like to say something. Peace be upon you. Good afternoon, ladies and gentlemen. Before I talk about the current situation, I would like to remind myself that that whenever there are difficulties, there will be ease and solutions. So this is just temporarily. All of us are together in combating this challenge. As for the current situation, as with the increase of cases, because of our testings and monitoring the cases, thank God, all of them are stable and we're not out of the expectations. If you would like to know the numbers as for the tests, now we are within the 4 weeks, we have conducted over 12,000 tests. The active cases are 58 cases, all of them from outside Bahrain. As for the repatriation plan, The cases, we have 85 cases confirmed of the disease, and we have 77 cases who have been discharged and recovered as within the guidelines and instructions of the World Health Organization. So we made sure that they are fully recovered and they have to have self-isolate for the certain days at home. As for the announcement of the death case, as mentioned by the Minister of Health, unfortunately, would like to express our deepest condolences to their family. A female national, 65 Bahraini national, because of the chronic health problems. So with the recovery of 77 cases, we have 214 cases in the quarantine. Out of them, 141 finished the quarantine incubation period, and they have been tested and made sure that they don't have the disease. So all the lab tests have been conducted to ensure that those who are infected, so that's why this would decrease the number of the cases, the society. Well, I have 4 messages I would like to mention. Well, they are about our current plan and the future plans. Well, the people of Bahrain have proved that they are really very much educated. That has been proved to the world. The educated people, their daily practices, they are more effective than more than any other precautionary plans. As you have seen, there are big countries that they were affected by the disease. But in Bahrain, we have the people listening to the instructions, and that's one of the elements of not having this disease spread. So you dealing with the with these instructions and to maintain the personal hygiene and having the hands washed regularly. So far we don't have any cases from within the kingdom. The third message is very important, and we have repeatedly mentioned, whether within the instructions, I call upon all influential people to take their responsibility in encouraging their society in following up the right practices. So this is one of the things we call upon all those influencers in our society. And the fourth message, as mentioned by the Minister of Health, what would be an obstacle would be rumors. So rumors would have really huge efforts of our parts to stop them, to deny them. So the right way to track information, and they are available on the website of the Ministry of Health. All of these information and numbers are there, and what they mean, these numbers are there accurately. So that's all I have, and I'll leave the floor for my colleague, Dr. Jamila Salman. As for the current medical situations in the Kingdom of Bahrain, as for the current cases, we are following up whether in the isolation or continuously by 24 hours by the specialized medical teams at a higher level. They're working 24 hours. As for the general cases, let's talk about the isolated cases. Some of them are under treatment. Most of them are stable. They don't take medication. Some of them are taking as part of the protection because they have some of the diseases, what we call them, like risk elements, like in terms of age or chronic diseases, so like diabetes or like chest diseases, uh, so that would affect uh, their health condition. So they are not related in terms of COVID-19. As I said, most of them are stable, and you would hear more cases being recovered and going back to their homes. Some of them would be monitored and would be tested more to ensure their safety and not have any other complications. Now we have two critical cases because of have some of the risks, as I mentioned them, and they are under intensive care. And as for those in the quarantine, they are stable. All of them are stable. They don't have symptoms. Just in case if anyone had symptoms on turned in from a negative, so we will ship them into the hospital. Unfortunately, you've heard of the Bahraini national 65 citizen. Unfortunately, she passed away. She came back to Bahrain indirectly from Iran. May she rest in peace. She had some chronic diseases and some underlying health problems, which complicated her case. And so we have, according to the World Health Organization, we've taken the right actions in looking after her, and because of the lack of immunity, unfortunately was really weak and was not at the expected level. And in this regard, I would like to express my sincere condolences for her family. And we are going to work hard in providing the highest standard health services for all the patients. As for the recovered and discharged cases, there are 77, and there are going to be more, hopefully, in the future. All of them will be retested in a timely manner. Even when they are out of hospital, after 2 weeks, they will be in self-isolate. And so we are following up in a total of 6-week follow-up. As for those in the quarantine, they are being followed up according to the standards of the World Health Organization. And before being discharged, we also retest them just to make sure that they don't have the disease and they're not into positive case. And before allowing them to go back to their family, we make sure that they are safe, and hopefully we'll see more numbers going out. And I would like to assure you, as mentioned by everyone, that the medical staff, the nursing staff are working 24 hours with all the patients in all the isolation and quarantine, and hopefully we'll see positive results. Thank you very much, the speakers, for the updates. Now we'll leave the floor for the questions, but please, let's just ask one question each. Good afternoon, Rasha Ibrahimi from Bana. Thank you very much. My question about the volunteers who had a chance to submit their applications. So what would be their roles? Will they be trained in a certain missions? And my second question, the repatriation plans, when are they going to be back to Bahrain? As for the first part, the volunteers, we announced yesterday. Thank God, when we announced that service, over 12,000 people applied for volunteering. And we had fields, like in 6 fields, each one would decide and select their field that they would like to volunteer in. So we will train them and prepare them. And what matters to us is like these volunteers would be healthy able, just for their sake, to protect them, and there are standards to implement for their cases, and when necessary, they will be distributed according to the places needed. As for the repatriation, we're working, the Ministry of Health, cooperating with the Ministry of Foreign Affairs. We have certain measures to bring back those people, those citizens in Iran, and hopefully they will be back. We are working now with the relevant authorities to schedule their timings. Tamam Abu Safi from Al Ayyam newspaper. My question is, you mentioned about the plans and dealing with the situation as it is in reality. Do you have any expectations to close shops or take some of the measures in line with other countries and just limit the shops to be like the hypermarket and pharmacies? Would the real current situation would lead to that? My second question, Lieutenant General, the reformation and rehabilitation centers are one of the risky places. So will the convicts be tested before going into those centers, because they might transfer the disease? Thank you. As I mentioned at the beginning, the situation is changing, so it is not fixed. This current situation, the government and the working team led by His Royal Highness the Crown Prince were measuring the current situation, and we're adding some precautionary measures. So the decision issued by the Council of Ministers is 250 gathering to be forbidden. So we see this is the most appropriate decision for the time being. As for what would happen in the future, tomorrow, we would hope that things would go more stable and would have more openness. But if we had to protect the society and take more precautionary measures by any chance in the increase of the numbers, that would be studied then. But as far as now, all the shops are working according to their current situation, and it's up to them if they would like to close their shops for any reason. It is their responsibility. We're not going to stop the public from going to shops or the malls at the current situation, with the exception of the 150 public. And when we say 150 public gathering, we mean in one closed place. So if we have, like, for example, a mall, it is open. So you can have more than 150. They are not in one closed place. So they might have interaction, close distance between them. Just to respond to your question, as for the reformation and rehabilitation centers, well, by the directives of the Minister of Interior, we already started to ensure that those inmates are not affected by this disease. As you have seen, the visits have been suspended for 2 weeks, mainly to take appropriate actions and to see how the situation will develop. Yesterday, all those convicts who have been pardoned, all have been tested before leaving the reformation and rehabilitation centers to make sure that they don't have any infection, to protect themselves and to protect their society. And we're going to test the rest. inmates in the centers. So also there are some measures like we have allocated in those centers, we have allocated buildings for quarantine as quarantines and for isolations for the infected, God forbid, if we had some infected cases before entering the prison. There are measures like we test their fevers and their symptoms, and we also test the lab tests. And this is undergoing, and we will ensure that all of them are tested. And also, we are disinfecting all the buildings in the set of the reformation and rehabilitation centers. Thank you very much for your question. من صحيفة Gulf Daily News لدي سؤال بخصوص الشخص الذي توفي بالأمس. هل كانت حالة طبيعية؟ السؤال الثاني، قلتم بأن هنالك شائعات حتى بين الأجانب بأن هنالك بعض الأجانب الذين موضوعين في العزل. هل هنالك أمر؟ هل علينا أن نصدق ذلك؟ السؤال الثاني، الشائعات، نشر وترويج الشائعات بين الأجانب. إن قلنا بأن هنالك شائعة بأن هنالك شخص واحد من الأجانب في العزل، ليس المواطنة. لم أستطع فهم سؤالك الأول، ولكن السؤال الثاني، مسألة العزل ليست للأجانب وغير الأجانب. إن كان هنالك فيروس منتشر في منطقة أو في مكان ما، إن كان هنالك خطر للانتشار، فسوف يتم عزل أولئك الذين تواصلوا مع الذين كانت لديهم الفيروس أيا كانت جنسيتهم، ليست فقط للأجانب. بالنسبة هنالك بعض الحالات للبحرينيين وغير البحرينيين، وكلهم متساوون في. شكرا. شكرا جزيلا من Gulf Daily News. شكرا على طمأنتنا، كان أسعدنا أن نستمع إلى هذه الجهود، وهي مطمئنة فعلا بأن كل شيء تحت السيطرة، وشكرا جزيلا لكم. لدي سؤالين للدكتورة جميلة والدكتور منار، إن سمحتم لي. هنالك بعض الأخبار بأن الأطفال، هنالك بعض المعدات التي سوف ترسل إلى البحرين لاختبار والفحص بشأن الكورونا. السؤال الثاني، ماذا عن المرافق؟ ربما في المرة الأولى التي تحدثت معكم عنها كانت هنالك مرافق إضافية. كم عدد مراكز العزل؟ هل هي فقط الEKK أم هنالك أيضا بعض أحد المستشفيات التي تم تخصيصها كمرفق للعزل؟ وأيضا إن أسأل، هنالك حالة في مستشفى السلمانية التي كانت حالة مصابة وتم تعقيم المكان. إذن وفقا كانت الطبيبة موجودة أو كان الطبيب موجود في تلك المستشفى، هل هنالك أي توصيات بهذا الشأن؟ يمكن أن أجيب إحدى أسئلتك وسوف نتشاطر مع الدكتورة جميلة الجواب. بالنسبة للفحص، نعم، في 18 مارس سوف نحصل على هذا الاختبار الذي في غضون 10 دقائق سوف نحصل على النتيجة. ربما لم يتم دراسته بشكل موسع، ولكنه قدم في بعض الدول مثلا في الصين وسنغافورة، ولأن لدينا النسبة العالية من الفحوصات، فستكون لدينا الفرصة لأن نجرب هذه الفحوصات، هذه الأدوات من الاختبارات. لدينا بروتوكولات في طريقة استخدامها، سوف نتأكد منها وفقا للمعايير الحالية. سوف نستخدمها مع بعض الأشخاص لنرى إن كانت ذات فعالية. وكما ذكرت بالنسبة لمرافق الحجر والعزل، لأجيب عن مرافق العزل، لدينا 3 مرافق عزل. لدينا ال EKK و HBD، ولدينا أيضا جد حفص، مركز جد حفص لتلبية الاحتياجات وكجزء من الإجراءات الاحترازية. إلى أي من هذه المرافق سوف نتوسع؟ لدينا بعض الخطط لذلك. بالنسبة للحجر الصحي، لدينا الحد كمرفق للحجر الصحي، سمعتم عنه. أيضا في جزيرة سترة يتسع ل3000 شخص، ويمكن توسعته إلى 4000 شخص. والآن لدينا هنالك 75 حالة، فلدينا كل المرافق التي تحتاجها جزيرة سترة، وتعد كمرفق نموذج يحتذى به. كيف أن الأشخاص لدينا في البحرين، كيف أننا أعددنا هذا المرفق في غضون 7 أيام. أضيف فقط لمرافق العزل، لدينا حاليا في خططنا 3 مرافق للعزل، ولدينا خطة أيضا للعزل الرابع. بعض الحالات هي حالات تحتاج إلى العناية المركزة، إذن لدينا خطة للعدد الحالي ربما ل300 شخص، ومع إمكانية توسعة القدرة الاستيعابية. ولكن حاليا لدينا 3 مرافق، وسوف يعد مرفق رابع تتعامل مع جميع الحالات، ويتم تصنيفها وفقا للحالات. ولكن في مملكة البحرين دائما ما نكون مستعدين إلى أسوأ الاحتمالات والسيناريوهات. إذن لدينا خطة لإعداد مرفق آخر فيما يتعلق بالطبيب الذي تم تأكيد حالته بالمرض، تم فحصها وذكر زملائي لدينا نظام قوي في تتبع الحالات. إذن نتوسع في ربما إلى أي حالة يتم إثباتها بأنها لديها الفيروس، فسوف نتعقب الأشخاص الذين تواصلوا معهم إلى مدى 100 شخص، وفي غضون ساعات عندما أثبتنا الحالة أغلقناها مؤقتا ولضمان أن تعمل لاحقا. ونسمى مثل هذه العملية نسميها الحالات مؤقتة، الإغلاق المؤقت. في مراكز العزل لدينا معايير رفيعة تتعلق بأولئك المصابين بشكل مثبت. الموعود from Algeria newspaper. First, we have listened carefully and with appreciation to the wise directives of His Majesty King Hamad bin Isa Al Khalifa, King of the Kingdom of Bahrain, and the follow-up and efforts of His Royal Highness the Crown Prince, and also His Royal Highness the Prime Minister. So, my question to the Minister of Health. So how far or when are we going to hear that the Kingdom of Bahrain to be fully disinfected and to have 0 cases, just to be optimistic? And if you allow me, Mr. Ali, so let me ask another question. Lieutenant General Tariq Al-Hassan, you mentioned about the plans, the national plans of, and your respectful ministry and your efforts and the directives of His Excellency, the Minister of Interior, and the National Defense Force, and you have the civil police. So, what would be their role in this situation? We've seen like the mosques, for example, on Fridays. We've seen, maybe with all respect, we've seen just some expats spreading the masks. So we have, as you have questions, we have questions. So what is the role of the civil police? And you've mentioned that the food items would be stored for up to 6 months. So Your Excellency, the Minister of Industry, Commerce and Tourism, Mr. Zayed bin Rashid Al-Zayani, would you like to tell us more about these items, if they're, for example, the expiration dates would be for 1 month? So can I ask more? Well, thank you very much. So thank you very much for your questions. So let me answer the difficult question to ask: when would this pandemic finish? Well, only God knows. Nobody knows, even around the world. Nobody knows when this would end. We're doing the precautionary measures even around the world. Thank God we don't have that huge spread. We are just preventing and we're controlling over this disease from the passengers, from those people inside Bahrain. So we would hopefully finish that. But only God knows. There is no answer as to when this would finish. And I don't think anyone can answer this question, even around the world. Thank you very much. And I'll leave the floor to His Excellency, the Minister of Industry. Well, when we said 6 months, it doesn't mean the same amount. We will just leave them in stores. So you are right. The foods, sometimes they have expiration, but we say the availability of food would be continuously available. And we focus on the items that would have longer expiration dates, and they are 13 items according to the World Health Organization. And sometimes they are over 6 months, like rice, sugar. So for those items that are less than 6 months, we are plans to cover those used. So if we're using, for example, 100 kilos, we would have 600 kilos. So we would use them and renew them. Whenever it is expired, we're not going to use it. And recently, we're combating within our ministry, as part of the inspection team, those who would manipulate with the dates of expiration. So we make sure that people are not harmed, and we make sure that they are protected. And we have identified, for example, one store, and today we have identified a store that violated those measures. Thank you very much, Mr. Jamal. As you mentioned about the plans for combating the disasters, when we mentioned about the food items, as mentioned by the Minister of Industry, those are the main items that they need to be there as part of the plans for the combating the disasters. As for the society police, you see, if you be really like Frank, you would see them everywhere. They have followed up the teams of the mobile testing units. They were in the graveyard, making sure that the procedures are there. They are within people, spreading awareness. So in this regard, I would like to express my sincere and deepest condolences for the family members of the deceased citizen, and I thank them for their understanding. It is really much appreciated. We have nothing but to thank them deeply for their cooperation. As for saying expats spreading masks, that is up to them. We don't have a recommendation to spread masks. So maybe doctors can say more about that, but the recommendations is for those masks are for those who are infected, and not to just scare people by and give them false protection that by wearing these masks. So as for the society, police, if you allow me, they are in all the situations, whether we mentioned at the beginning that combating this virus is collective, is not just one entity. So we're like any other entities, we are complementing the efforts, the national efforts. And it is continuous 24 hours, as I mentioned before. Each entity has its own role. The society police, whether Ministry of Interior and other bodies. So we cannot just list each role now, but we say that there is a national team established by His Royal Highness the Crown Prince, led by Lieutenant General Sheikh Mohammed bin Abdullah, and it is with high sufficiency, and it is under the supervision of His Royal Highness the Crown Prince. By these efforts, we are in very good position, even appreciated by the World Health Organization. It is not easy for a country. We've seen countries like China and other countries, how that virus spread over the countries. So we are in a very good situation, but it does not mean we are zero cases. No, this is going updated, so we need to have plans and we need to think of the worst. But thank God we are in good situation. So each one of us is doing their role, and we are doing that collectively. Thank you very much. Thank you very much all for your efforts. Budur al-Malki from Al Bilad newspaper. We all pray for Bahrain to be safe. So my first question, Lieutenant General Tariq Al-Hassan, as for the funeral, how did it go? As for Her Excellency the Minister of Health, we had over 50 students coming from China. So what are the updates in this regard? Have they been tested and are they negative? And my question to Dr. Manaf, what does it mean if the World Health Organization praises the Bahraini efforts? Would that put you in a new challenge domestically? Thank you very much. Thank you for your question. As for the funerals that were held today, there was a specialized team by the to deal with this situation within the measurements and by witness of the family members. But the main role I would like to focus on is the collaboration of the family members and the members of the deceased. May her soul rest in peace. They helped us, and it is a national responsibility. So I really find it of pride. And as a relevant authority, we had to coordinate with the Ministry of Health and the relevant authorities to ensure that the items and the place would be disinfected and the measurements would be healthy. Thank you. What about the students coming from China? Well, for the students coming from China, like the other countries, they've been tested all. Nobody would come from the affected countries without being tested. So thank God their tests were negative. So they've been set in a quarantine for 14 days as like the other cases. Thank you very much, Ms. Budur. Not only the World Health Organization that praised the Kingdom of Bahrain, even Arab and expat channels praised these efforts of the kingdom. Just to let you know that we did not seek to be praised. When we set a plan, we had targeted objective, the safety of the Bahraini citizens and expats and residents. So even as I mentioned, one of the ambassadors mentioned that they feel more safe in Bahrain. So what is the reason of the success of Bahrain, aside from transparency and being an example to the world? You being shared in setting the plan, and by doing each step, you share with us each step. So you knew about the steps, you knew about the next steps. The social partnership is one of the main reasons of having our plan success. And I think it is a lesson to be studied at universities, how to activate the social partnership in combating this virus. So thank you very much. Would you like to add anything, speakers? Thank you, Dr. Manaf. I would like to respond to Mr. Jamal. We are facing an enemy that is faced by all. And what you see, Bahrain is one of the strongest, in a strongest position. The Bahraini team, as you see, we have people behind the scenes, thanks to the wise leadership and thanks to the cooperation at all levels, in all authorities. Just to give you an example, what's happening at the Bahrain International Airport. We have the collaboration in all the teams, the civil aviation, Gulf, all of the teams at the airport are working. Before coming to the conference, we have studied, so we go in line with the updates. We have shared enemy and we all help each other. It is of pride, and this is what real Bahrainis are. This is our team, and thank God we will be. Can we have a question? Go ahead. Before concluding, just to remind one thing we mentioned maybe before, and even Dr. Jamila pointed out, the team established by the Ministry of Health to track those who had contacts with the infected people, to reduce and decrease the number of the infected people. So we have established a team in charge of studying any cases of those infected. So they follow up with those who had contacts with them and list the information on the website of the Ministry of Health. And so I call upon everyone, if there is any relation to those who had been contacted, they should call the hotline 444 for their sake and for the sake of their family and society. Thank you very much. I think we'll try to add something, Dr. Manaf. I mentioned a point now. His Royal Highness the Crown Prince has always said in the meetings, focused on 3 points. Our objective is 3 points: transparency, number one; two, social partnership; third, the safety and safeguard of the citizens and residents. So this is focused on the unity. We, hand by hand, help us. That's why we are optimistic. Whether this goes short or long, we are hand by hand, we'll face that, and we are going to face that challenge. So whether this is a month or 3 months, Bahraini team will win. Thank you very much, the speakers. Thank you very much, the representatives of the press. Thank you, everyone.